Hello, I'm Catherine Gamble. I am the professional lead for the Royal College of Nursing, particularly focusing on mental health. I lead the programme that at the moment is focusing on a number of key areas that are affecting mental health nurses and those that they serve, the patients and their families and loved ones. One of the key things that have come into my attention when I took up post just under 2 years ago now is the really rising concern around the parity of esteem. By parity of esteem, I'm talking about the equality between how much services are paid to serve those with mental health as well as physical health. And one of the key concerns about that is that mental health nurses have known for many years that actually physical health is actually not properly, appropriately served by the way that we work. We have been trained in what was known as a dualistic split, so body and mind. I'm doubly qualified, and yet I haven't maintained my skills in my general nursing as much as I have maintained my skills in mental health. And we have done something about that. We've recently, in the last year, at the Congress of this year actually, published the Parity of Esteem, Delivering Physical Health Equality for Those with Serious Mental Illness. I talked about the opportunities that we all have as people who don't have serious mental illness. We know that people who do have a serious mental illness are 15 to 20 years more likely to die 15 to 20 years than the average population, and also that they will be, if they are going to be diagnosed with a serious physical disorder, they're much more likely to die faster than somebody who doesn't have a physical health problem. What we've also done at the RCN at the moment is doing a number of key areas of work, which is the programme. So we're working on suicide awareness, we're working on not just the parity of esteem, but also we've worked with colleagues around the Mental Health Act review. We've also been doing some work on well-being, and in the next year we're looking at how we support people so that they become much more aware of suicide awareness and the well-being of mental health nurses. I represent as mental health members at a number of different national strategy groups, that being the restrictive practice, and also, as I said, the National Suicide Awareness Group, and also looking at the long-term plan, advising government at the moment around workforce issues, and obviously what actually is therapeutic staffing levels is a piece of research that we were wanted to investigate through the RCN forum. So that's really what I do. I've had a real privilege of, since taking over, that I have been able to tap into all sorts of people's expertise who are mental health nurses, who are demonstrating mental health nursing at its best. So I have them to thank, and I can provide you with links on the website for the RCN Open site, which is providing an overview of what the activity is all about. And I hope by doing that we are raising the profile of some excellent practice and research activity that every mental health nurse should be aware of and be involved in. So I want to thank those experts, and they provided their photographs and a breakdown of what their expertise lies in. And so the next year will be really an opportunity to highlight their involvement through the RCN programme. The RCN Forum is always looking for new members and new ideas and new thoughts, so please get in contact because I can help to develop some of the key learning activities that we are rolling out across the RCN and across the 4 countries.